Welcome to Dr. Loria's Girth consultation video. This is part 1 of a 4-part series. Dr. Loria will discuss a real patient story, procedure highlights, and treatment comparisons. Additionally, he will cover expected gains, achievable goals, and the relationship between penile girth size and vaginal stimulation.
I'd like to welcome you to this video consultation regarding male enhancement. My name is Dr. Victor Loria, and I'll be discussing some very important and valuable information regarding the subject. Please be patient. There's a lot to review and discuss. Now, first let me start with a patient story. And all my stories are true. I just kind of relate these stories to you because it may, in fact, be happening to you. Okay? I had a patient who was is probably in his mid-40s, married for 15, 20 years. They must have 3 or 4 children or so. And he had come to my office seeking a male enhancement. And he was very depressed, and I could tell. And I had asked him what's happening and so forth. He says, well, things have changed over the years during my marriage, and he just wanted to do something. He didn't know exactly what to do, but he figured, well, let's try this male enhancement. Basically, what happened in his marriage is that, and these are his words, basically he said that he would have to beg his wife for intercourse once a month. I used to beg once a week, but he felt so depressed and rejected that he limits himself to once a month. That's not a good situation. So anyway, we had discussed the procedures. He decided to have 2 procedures because in essence he was basically at about the average 4 3/4 size. So if you see there's a 2-dimensional circular circumferential chart here, and you'll see 4.5 and 5. This is the usual range of normal or average, between 4 and 5, generally between 4.5 and 5 more accurately. He was at 4 3/4, okay, 4 3/4, which basically is like this model here. This is a model that's 4 3/4 in circumference, okay? Now the normal range is about 4 1/4 to 4 3/4 or 5. So basically this is the range of normal girth, okay? So he had had 2 treatments. Now what had happened during his 2 treatments is that actually he went from 4 3/4 to this one 6 3/4. A very good gain for 2 treatments. That's 2 inches in circumferential increase. A lot of collagen production there. So basically he went from approximately this size, let's get the more accurate one. He was about 4 3/4. This is erect girth, okay? He went to this size, okay? Now notice the difference here. This is 6 3/4, 5 1/4. So he started out with this and ended with that, okay? That is an incredible increase in size. Now, what happened afterwards? Well, he had explained to me that, well, actually he came back a few months later, and he wanted a 3rd treatment because he actually wanted to get over 7 inches. He wanted this range now, from here to here, okay, which is this size, okay? So if you notice, he started out here. He is currently here in girth, okay? Now he wants to go from his original to here. Okay, you see the difference. All right, let's get this lined up. All right, he wants to increase. So he went from this size, about 5, to this size. Okay, that's 6 3/4. And now he wants to go over 7, 7 1/2. Okay, you can see the difference. Okay, so there you have that. So then he came into the office. He wanted to have another procedure. And I said, well, what's happening with your wife and so forth? He said, well, my wife is upset that I'm coming in again because we cannot have intercourse for 21 days. And what that means is his wife's upset that she cannot have intercourse because now they have intercourse 4 or 5 times a week, okay? And there's a 21-day healing time, so he can't have intercourse for that time frame. So that's really positive. That's a really good situation change in his life. Now, if you saw him back then when he was depressed to now, he looks totally different, okay? Absolutely different. He has self-esteem, his confidence is way high. Now, why did this happen? What happened to his wife and his relationship? 2 things happened. Number 1, his attitude changed. When his confidence and self-esteem went up, I think that impressed his wife, and that's a plus for a woman to see that, okay? And secondly, this here size that he has definitely will stimulate more during intercourse. There's no doubt about it. And we're going to talk about that in more detail later, exactly why girth stimulates far more than length, penile length, in regarding sexual stimulation and so forth. We're going to go over that in a little while, okay? Now, let's move forward. That was my first story. But let's move on to some highlights, okay? The most important thing to remember in this whole video presentation is that the procedure, which I call the platinum procedure, is a medical procedure, okay? It's a minimally invasive permanent filler treatment, okay? Very important. Now, what are your options? You could have this minimally invasive procedure done to increase your size, or you could have surgery. There's all sorts of surgery available, okay? Now, they're very invasive and the risk goes way up, okay? What I offer in this minimally invasive procedure is no cutting, no stitches, no scalpels, no general anesthesia. That brings the risk way down, okay? I've done probably 2,000 treatments so far, and I haven't had one documented infection. That's a phenomenal result. Now, if I were to do surgery, let's say we select the surgery that's available today. There's alloderm and belladerm. That's taking someone else's skin. Let's say, for example, we want to do surgery, and you opted for that. What we would do is cut the skin around here, pull it down like pulling down a pair of pants, pull the skin down, and take someone else's skin, that's what alloderm and belladerm is, and put it here and actually stitch it in, okay? Stitch it in to the penis and then pull the skin back up and stitch it. Now, to me, that doesn't sound very attractive, and obviously it's very invasive, okay? So even if I was doing the procedure, it doesn't matter who does it, it's the invasiveness, the exposure to air that will increase your risk of infection dramatically, okay? Plus there's general anesthesia, plus there's cutting. Anytime you have a scalpel, you can cause tissue damage, nerve damage, etc. Okay, it doesn't matter, again, who it is. So the option you have is a minimally invasive procedure that I offer, and it's used with permanent fillers, so that means it's a permanent result, okay? Now let's talk about gains and goals, okay? What gains are there to be expected and what goals do I recommend, okay? Now, typically after the first procedure, and I had mentioned this already briefly, but let's talk about this again when I mentioned my patient and his story. Most men are around 4 to about, well, actually the real average is 4 3/4 girth, okay? So the girth really is right around in between here, 4.5 and 5. So that's really the range. I mean, usually most guys are around here, 4 to 5 in general, but the real average is closer to 4.75 circumference, okay? 4.75 inches in circumference and so forth, all right? So now, after one treatment, we expect you to go from 4.75 to at least around 5.5, okay? Maybe somewhere in between 5.75, right? A second treatment, we expect you to go to about 6.5, which is right here, okay? Maybe a little more, depends on how much collagen you make. So that's just the 2D version. So let's assume for a moment you're about 4 1/4 in circumference or somewhere in between. This is a little bit bigger, 5 1/4. So let's just say you're about 4 1/4 or 4.5 in circumference. The first treatment, I expect you to get to about, this is 5 3/4. I don't know if you'll get to this, but you can come close to this, 5 3/4 in girth. And the second treatment, we would want you to get closer to 6.5 or 6 3/4, roughly. These are just the models I have. But you'll roughly be, I'm sorry, whoa, that's the 7 3/4. This is the one. So you were probably saying, wow, that's a nice jump, you know, a nice gain. It's actually, here's the 6 3/4 here, okay? This particular size, okay, it could be 6.5 to 7, but this is 6 3/4. This is an excellent goal. It usually takes 2 to 3 treatments to achieve. This here is very stimulating for intercourse. And let me explain why and the anatomy of the vagina so you can understand why girth is so more important than length, okay? And here's the reasons. If you look at the anatomy, the female anatomy, okay, I'm going to show you this diagram here. It shows the pubic area here of the woman, and it shows the vaginal opening, okay? and it shows the clitoris right on the top over here, okay? That is a normal anatomy, okay? Now the clitoris, which is sitting right over here on the top, okay, the vaginal opening is here for intercourse. The stimulatory mass or tissue mass is right over here. It's highly stimulating or stimulative for producing orgasms and so forth, okay, or resulting in orgasms, right? Now, if, for example, you were to have intercourse, right, the penis would obviously enter into the vagina, okay? But the situation is this: you only see a very small portion of the nervous system that stimulates orgasms. That's the clitoris. But if you look throughout the whole canal of the vaginal area, there's a whole branching nerves. There's a branching network of nerves that go along the vaginal canal. This here will demonstrate in a different view. Difficult maybe to see this, but I'm going to show this to you anyway. Right here is where the vaginal canal is, okay? And it's only so long because there's a cervix. There's a uterus here with the cervix in the way. So if you're longer than 6-7 inches, you're going to be hitting into that cervix or uterus area, okay? But here's the key. The vaginal canal that's right over here is lined with nerves, okay? So the clitoris is just the tip of the iceberg. You're only seeing a very little portion of the neural network that causes orgasms. So if you were to have intercourse with an average size penile girth, okay, there's only so much vaginal wall stimulation that will occur. Now imagine now going in with this, with 6 3/4 girth, you'll be touching all 4 walls of the vaginal canal, and that's why many women will have multiple orgasms with something like this, okay, this particular size. That's why I recommend this. I've interviewed hundreds of patients and spouses and men who started out with this size and you know, wound up with this size. And I even have men going to the 7 3/8 size. I even have men larger. I even have men this size. How ridiculous this is. Almost 8.5 inches in circumference. Okay, I do have men this size. However, this is a problem because this is difficult now to enter into the vaginal opening and canal. Okay, I have men that say that they cannot enter into some women with this size. Okay, I don't recommend this. Okay, even this would be the high end 7 3/4. Okay, this is almost 8 3/4. This is 7 3/4. Big differences here. Okay, so my recommendation is to stay within the 6 3/4, and the very high end would be the 7 3/4. Okay, and again, if you recall, we're starting out with this. Let's keep this in perspective. Okay, here's our 4 1/4, right? I mean, these sizes are tremendously different. There's a huge difference here in regarding size change and, of course, response or stimulation of the vaginal canal. Okay, when you understand this, that girth is far more important than length, you'll not worry so much about your 5 or 6 inch normal average length. It's perfectly fine. Okay, it might look better, or you know, to have something longer, but functionally it's not better. Okay, functionally it's not better. So let's demystify that right away. So don't worry about your average 5 or 6 length. Perfectly fine. Okay.